Hi, I'm Dr. Nicole Rogers, a hair transplant surgeon in New Orleans, Louisiana, and today I'm going to review post-operative wound care instructions after hair transplant, just like you were my patient. So in New Orleans, we have these things we affectionately call go cups, and that's when you're leaving a bar late at night and you haven't quite finished your beverage. They'll actually let you take that cup with you. And at Hair Restoration of the South, we have go bags. And so in these little go bags, which we give you at the end of the procedure before you go back to your home or your hotel, there's a variety of things that we provide that help take care of the grafts in that post-operative period and just make your life a little bit easier. So the first thing that we provide is something called liposomal ATP. And this is mixed up in a saline solution in order so that you can spray it onto the grafted area. We usually recommend that you do this 2 to 3 times per day for 7 to 10 days after the procedure. You don't need to apply it to the donor area, just the recipient grafted area. After you spray it, you may want to just gently pat the excess off using some 4x4 gauze. We provide that as well. And then when you get in the shower, you're probably going to want to rinse the area starting the next morning. You're welcome to use this little washcloth, which we provide. We recommend that you lay it over the grafted area just to break the pressure from the spray nozzle. The other option is that when you go in the shower, you can fill up a tall cup of water and just gently pour that over the grafted area as well. So either option works fine by us. The only thing that we ask is that you don't shampoo the grafted area until the 3rd day, because we don't want you to accidentally dislodge any of those grafts. Now, we do provide you with some Aquaphor just to massage into the donor area, whether you have a linear strip or FUT or whether we do the FUE. It's nice if you can have some kind of ointment over that donor area. If you decide you want to pick up some polysporin and have the added antibacterial effect, that's certainly great as well. Some people get very annoyed by the grafts, usually around day 5 to 7. So it's optional if you want to use a salicylic acid based shampoo like this one, T-Sal, or Baker's PNS shampoo. It's something you can usually find on Amazon. And that can help just gently dissolve the scabs a little quicker, but it's certainly not necessary. You can wait the full 7 to 10 days until they drop off on their own as well. We also send you with a copy of the instructions. You will have already received this in the mail before your procedure, but we do like to make sure you have another copy with you in your go bag, as well as a page with instructions for your hairdresser. And this is just if they have any questions. It's certainly optional for you to share this with them. But you can see here, it explains what day you had the procedure, what kind of harvesting was done, and then sometimes they're just very curious and they want to know more about the procedure. We also send you with a pillowcase cover, not so much for the night of surgery, but for the day after. When the bandage comes off, you may have just a little bit of crusting or exudate, and so this way it helps protect your pillowcase. And last but not least, we like to send you with some purple Hershey Kisses so you don't go hungry the night of. Thanks so much for watching. Hope this was helpful.